Okay friends, hello, how are you? Welcome. So today we will discuss about the surface landmarks of the whole our first year MBBS. My name is Dr. Ashok Isawadi. Okay, so let us start from the surface landmark. So the surface landmark of the lower limb is the most important. Okay, after the lower limb, you can say that pleura, lungs, and even your heart. These surface landmarks are mostly asked in the exams. Okay, yes. Still, there is some surface landmark of the face and neck also that we will discuss. Okay, and as time permit, we will also see our upper limb surface landmark. Okay, so here there is a no human body that that is available. So I will discuss I will discuss my surface landmarks on images. Okay, so I have yes, but it will be very clear. Okay, so let us start. Okay. So here, as you know that as first we will discuss about the inguinal ligament, then a midpoint of the mid-inguinal point. Okay, as you know that both are different. Suppose as I draw here the pubic hip bone, as you see hip bone. Okay, suppose this is a part of the ilium of the hip bone, and here is your pubic symphysis. So this is your ASIS. From the ASIS to the pubic symphysis, there is a called as the mid-inguinal point, and from the ASIS to pubic tubercle, which is just lateral to the pubic symphysis. Okay, so this point will be called as this line is called as the inguinal ligament. Okay, yes. So if I draw like inguinal, if this is an inguinal ligament, okay, like this, yes, and if we just extend this inguinal ligament, so it will be your this mid-inguinal ligament, like this. So here is your pubic tubercle, this is your pubic tubercle. If I just extend the inguinal ligament, you will get this mid-inguinal point. Okay, yes. So this inguinal ligament's midpoint is called as the midpoint of the inguinal ligament, and this mid-inguinal point will slightly medial to the this inguinal ligament. Okay, yes, till this you can understand clearly. Okay, now let's move to the surface landmark. This is the basic. Okay, so let us first discuss about the so in the surface landmark of the lower limb, the veins are the most important. So first let us discuss about the veins. So as you see here, the base of the metatarsal, as we draw a line at the base of the metatarsal, it will be dorsal venous arch. Okay, so medial angle of the dorsal venous arch, you draw the first point, then after you will second point you will draw at anterior surface of the medial malleolus. Then after third point that you will draw is between the upper two third and lower one third of the tibia. Okay, the fourth point that you will draw is here, which is medial, which is level of which is at the adductor tubercle. In the femur, you will see here adductor tubercle, or you will feel it also. Okay, so at adductor tubercle you will draw the line, the point. So here is your first point, here is your second, this is your third point, this is your fourth point, and your fifth point is at the saphenous opening. Okay, now how you will draw the saphenous opening? See, suppose this is your pubic tubercle. Okay, yeah. So from the pubic tubercle, if this is a pubic tubercle, then 4 centimeter downward and 4 centimeter lateral, here is your saphenous opening. Okay, now saphenous opening is arranged like this laterally, and it is length is around 2.5 centimeter like this, and length is around 2.5 centimeter, and width is around 2 centimeter. So this how your saphenous opening is located. Okay, so this saphenous opening is will be your fifth point, fifth or sixth. Okay, so by this fifth point, this is 1, 2, 3, 4 and 5. By joining this fifth point, there will be your great saphenous vein. Okay, yeah. Now let us see the small saphenous vein. Okay, here the photo is not. I generated this photo with me. Okay, yeah. So this is the lateral side of the leg. This is your medial side. Okay, this is your medial side, and this is your lateral side of the leg. Okay, so at the lateral side, this is your lateral malleolus. Okay, so at the base of the first metatarsal, there is your dorsal venous arch. Okay, yes. So from at the lateral point of the dorsal venous arch, this will be your first point for the small saphenous vein. Then after, behind the lateral malleolus, this will be your second point for the small saphenous vein. Okay, yes, clear. See here, in the great saphenous vein, the point will be at the in front of the medial malleolus, but in the small saphenous vein, the point will be at the posterior to the lateral malleolus. Okay, yes. Thereafter, draw the third point just lateral to the tendocalcaneus. I know the tendocalcaneus. Tendocalcaneus is the triceps gastrocnemius, soleus antiplantaris muscle, common insertion, which is at the suppose this is the calcaneum. So calcaneum's middle 1/3 of the posterior surface is your insertion of the tendocalcaneus. Okay, yes. So just lateral to that, draw your third point C, and draw your fourth point at the center of the popliteal fossa. Okay, suppose this is the popliteal fossa, so I draw it here. Okay, yes. So this is your first point, second point, third point, and fourth point. So draw all the point, connect all these point. This will be your small saphenous vein. Okay, clear? I hope you are getting it right. Yes. So now just go further. Let us discuss about the dorsalis pedis artery. Suppose here is your medial malleolus and here is your lateral malleolus. So the midpoint between the distance between the medial and the lateral malleolus will be your first point for the dorsalis pedis artery. Then after, the point at the point between the two metatarsal bone, point between the first intermetatarsal space will be your second point, and draw this will be your dorsalis pedis artery. Okay, great. Yeah. Now let us see the sciatic nerve, which is the most important in this part. Okay, yeah. So see here, this is your posterior superior iliac spine. Here we see the anterior superior iliac spine. Okay, so as the anterior superior, as you see the hip bone, The anterior superior iliac spine is anterior side of the iliac crest. Okay, and the posterior side will be your posterior superior iliac spine. Okay, so you can feel it. Okay, yeah. So from the posterior superior iliac spine to this ischial tuberosity. Can you see the ischial Are you see the ischial tuberosity? Okay, let us see. I will see. I'm not real one, but I drawn it. Okay, just a minute, guys. Yes. So, suppose I will draw it here. So it is like this. So okay, yeah. I will make it small. Okay. Now see, like this. This is your posterior superior iliac spine. Okay, and this is your ischial tuberosity. This part is your ischial tuberosity. Okay, so let us draw the line from the posterior superior iliac spine to the ischial tuberosity. Okay, now the midpoint of this line. Okay, midpoint of this line, draw. Yes, we will draw it. Now the 2.5 centimeter lateral to this midpoint, there will be a point which is the first point of this sciatic nerve, Okay, great. I will repeat it again. Okay, let us say. Okay, so this is your posterior superior iliac spine. This is your ischial tuberosity. Let us try and draw it between them. Okay, yes, drawn. This is the midpoint of that line. So 2.5 centimeter from the midpoint of that line, which is the first point of the sciatic nerve. Okay, then again a line draw from the ischial tuberosity to the greater trochanter. Okay, the midpoint of that line is here. So just slightly medial to that midpoint of the line will be your second point of the sciatic nerve, and the third point will at the junction of the upper 2/3 and lower 1/3 of the femur or of the thigh. This will be your third point in the midline. Okay, this will be your third point. This will be your second point, and this will be your first point. Yes, this is second. Okay, let us draw, connect this. This is your sciatic nerve. Okay, clear it? Yes. Now let us move further. This is the midpoint of the middle 1/3 or upper 2/3 and lower 1/3, or middle 1/3 and lower 1/3 junction. Okay, both are same. Okay, now slightly medial to this point, that will be a first point of this artery. Okay, now you will guess the artery. Okay, yeah. This is the first point of artery. Now at the middle of the back of the knee. Okay, so this is the back of the knee. The midpoint of the back of the knee means midpoint of the popliteal fossa. You can say like that. Okay, and this will be your second point of the artery, and this will be your third point artery. What is at where the third point is? Okay, yes. So third point is exactly back side. Okay, suppose here is your tibia. Okay, I'll just show it like this. Okay, so it is your tibial tuberosity in the anterior part. Okay, so if we draw the back of the leg, just behind it in the midline will be your third point of the popliteal artery. Okay, yes. Oh, I told you the artery. Okay, Yes, so this is your popliteal artery. Now, let us see the common peroneal nerve. Tibial nerve is not so much important, but common peroneal nerve is quite important. So this is your point at the upper two-third and the middle one-third. Sorry, upper two-third and the lower one-third junction. Okay, this will be your first point of the common peroneal nerve. Then after, behind you feel the head of the fibula just below the knee. Okay, at the lateral side of the leg. This will be your the second point of the common peroneal nerve, and just below the neck you will feel the neck of the fibula. Just below the head you will feel the neck of the fibula. So all these 3 points will join and they will form the your common peroneal nerve. Okay, so are you get it? Okay, now all this artery, nerve and the vein is completed. Now yes, there is a femoral artery remaining. I will teach you just a minute. But before that, we will discuss about the here flexor retinaculum, extensor retinaculum, and lateral retinaculum. Okay, yes, it will be easy. So let us discuss about the superior extensor retinaculum. The superior extensor retinaculum and the inferior extensor retinaculum. Okay, so superior extensor retinaculum is quite easy. See, suppose this is your fibula, right? Yes, and that side is your tibia. Okay, clear. So on the lower part of the fibula and the tibia, between them there is your superior extensor retinaculum. So I draw it some part here, right? Okay, because here is your tibia and that side is your fibula. Okay, clear? Yes. Now let us discuss about the inferior extensor retinaculum. So inferior extensor retinaculum is of the Y shape. Okay, I will roughly draw it here. Then after I will tell you. Okay, suppose this is your tibia and this will be your fibula. Okay, clear? Here is your talus and here is your calcaneum. Now from the superior surface of the calcaneum, to the medial malleolus, this will be your stem, and from here to here it will be your upper part. And yes, okay, this is fibula, this is tibia, this is calcaneum. From the superior surface of the calcaneum to the medial malleolus, it will be your upper part and the stem, and from that it is gone quietly, but from there here to the plantar retinaculum, it will be your lower part. Okay, or lower bed. Stem is around 1.5 centimeter. So overlay it looks like that, this. Okay, yes. Stem will be 1.5 centimeter thick, and this will be 1 centimeter thick, 1 centimeter wide, and this also will be 1 centimeter wide. Okay, yes. So point medial to the tendon of the extensor digitorum longus, okay, will be your stem part, like this. Okay, yes. So at where it will divide, point medial to the extensor digitorum longus. Okay, point medial to the extensor digitorum longus. So I have drawn it here. Suppose this is your superior surface of the calcaneum, you will draw it like this. Okay, yes. And here is your point medial to the extensor digitorum longus. Okay, now from there you will see here that here it will be your frontal aponeurosis. So this will be your lower vein, and here will be medial malleolus. So it will be your upper vein. Okay. So these both band are 1.1 centimeter. Sorry, these both band are 1 centimeter wide, and this band is 1.5 centimeter wide. Okay. Now let us see last flexor retinaculum. So flexor retinaculum is like here. In here, suppose this is a leg. Okay, here is a middle malleolus. So it is like this. It is like this. It extends first to the medial malleolus, and second it running downward and backward and medial side like this. So okay, so this will be your flexor retinaculum. Okay, great. So all the things is cleared. Okay, now let us see the femoral artery. Femoral artery first point is at the mid-inguinal point. Okay, and it's easy to see the femoral artery. Now see, suppose here is your mid-inguinal point. As you can see that as you know very well what is the mid-inguinal point. So, and second point is here at the adductor tubercle. Sorry, I have drawn adductor tubercle here. Okay, so this will be your femoral artery. Let us divide into three parts. So upper 1/3 part shows the femoral artery in the femoral triangle. Then after middle 1/3 part shows the femoral artery in the adductor canal. Okay, yes, adductor canal. Okay, it's clear to all of you. Yes. So it's about the femoral artery, and here your all lower limb is finished. Now let us go to the HFN. Okay, yes. Okay, let us first see about the thorax, then we will go to the HFN. Okay. Yeah. So, as you see in your exam that you will get surface landmark about the pleura, about the drawing of the pleura or lungs or the heart. Then first your work is to see your jugular notch. Then after fill sternal angle 2 or 2.5 centimeter below it, and then after this sternal angle count your second rib. Okay, then this will be your sternum, body of the sternum, and feel the xiphoid process and feel the lower margin of the rib. Okay, clear? Yes. So this will be your first work. Now let us see about the lungs. So first of all, the apex of the lung. Okay. So this is the chemical that you will feel here, right? Okay. Now first the first point is of the apex of the lung is at the junction between the medial 1/3 and the middle 1/3. Okay, so I will show you the clavicle. Just a minute, guys. Okay, so this will be your clavicle. Okay, this is your anterior side. This will be your posterior side. Okay, so this will be your middle. This junction, I am talking about this junction. Okay, sorry, I am talking about this junction, which is about medial 1/3 and this middle 1/3. Okay, yes, this is middle and this is medial. At the junction of these, mark your first point. Then mark your second point is 2.5 centimeter above the clavicle. Okay, yes. and then mark your third point at sternoclavicular midpoint of the sternoclavicular joint. As you see. Okay, so this is your apex. Okay, so this is your clavicle. I talked about this point. Okay, yes. First, this will be your first point. Then after, this will be your second point, which is 2 or 2.5 centimeter above the clavicle, and let us mark this third point at the at this sternoclavicular junction, at this sternum, and here will be your clavicle. So at this sternoclavicular junction, this mark your third point. So your apex will like this. Okay, your apex will like this. Okay, now let descend this apex to the sternal angle. Okay, okay, like this. Okay, now still descend them at the level of the fourth coastal cartilage. Okay, now the right lung will descend to the level of the sixth coastal cartilage. Okay, yes. The anterior border of the right lung will descend to the sixth coastal cartilage like this, from the sternoclavicular joint to the sternal angle, then fourth, then sixth. The sixth, the line will descend clearly. But what will happen in the left lung? This is your sternal angle. From the sternal angle, this will be your fourth coastal cartilage. So from the fourth coastal cartilage, this line will goes to laterally, and then it makes the cardiac notch like this, and here both will come at the sixth coastal cartilage. Okay, this will descend directly to the sixth coastal cartilage, and this will descend by following the notch on the sixth coastal cartilage. Okay, yeah. Now, what happened? The lung will go from the sixth coastal cartilage to the laterally, and here also it goes to the laterally. Okay, yes, clear. Now, here in the mid axillary line, it goes to the laterally, but it slightly descending downward. Okay, it slightly descends downward. Okay, clear? Yes. I will repeat it again. Apex is clear. From the sternoclavicular joint, the both lung will come downward. Sternal angle, right lung descends downward clearly to the sixth coastal cartilage, and this will forming the cardiac notch at the level of the fourth coastal cartilage goes laterally, and this will both come at the sixth coastal cartilage. Okay, now from the sixth coastal cartilage, these tongues passing laterally and downward, and this is your mid axillary line. They will meet at the mid axillary line at the A3. Okay, yes. This will also come at the A3 in the mid axillary line, and this will also come at the A3 in the mid axillary line. Okay, yes. Then after, they further descends and passing downward. Okay, they further descends and passing downward like this, and they will come at the 10th rib. They will come at the 10th rib. Okay, clear? Yes. So for the lungs, remember 6, 8 and 10. To the 6, they will descend down. Thereafter at the 8, they come at the level of the 8th rib in the mid axillary line, and in the paravertebral line, they will come at the 10th rib. Okay, 10th rib. Is that clear or not? Okay, clear. Now As we descend the lung 6, 8 and 10 through. Okay, just like that, add 2 more, 8, 10 and the 12. This will for the pleura. This will for the pleura. Means at the mid clavicular line, pleura is at the 8th costal cartilage, 8th rib. Then after in the mid axillary line, pleura is at the 10th rib, and at the 12th. Okay, at the paravertebral line, the pleura will be at the 12th rib. Okay, clear. So I drawn this pleura. This clear line is of the pleura. Okay, yes. So it is like this at the 8th rib, at the 10th rib, and behind at the 12th rib. Okay, clear? Yes. But the cardiac notch of the pleura will slightly shallower than the lung. Okay, yes. The lung cardiac notch is more deep, and this will be less deep. This is of the pleura, and this is of the lung, right? Okay, are you clear? Yes, clear. Now, let us discuss about the heart. The first point that you notice for the drawing the heart is this. What is this? This is your this point is at the second rib. This point is at the lower border of the second rib. This point is at the lower border of second rib. Clear? Yes. This point is at the upper border of third rib. Then after this point is this is your third point, which will be at the lower border of fourth rib. Okay, yes. Then after this point, which will be your fourth point, will at the seventh rib or seventh costal cartilage. And or you can exactly see that it will be either mostly right at the sixth costal cartilage. Okay, yes. Then after this point will be your fifth intercostal space. Fifth intercostal space. Okay, is it clear? So this point is your first point, which is at the level of the yes, upper border of the second rib. Then after this will be your second point, which is at the level of the upper border of the upper border of the third rib, and this is at the lower border of the second rib. Then after this will be at the sixth costal cartilage. Then after this will be at the fourth rib lower border. Okay, yes, and this will be at the fifth intercostal space. So this diagram is not perfectly drawn. If I draw it perfectly, then it will be like this. Like this is your first point. Then after this is your first point, which is at the see, remember the rib and the border. Okay, this is your first point, which is at the lower border of the second rib. This is your third point. Second point. My mistake. Sorry, guys. I hope it will be confusing, but try to understand. I will make it easier. Okay, let us draw it. First point, draw, is at the lower border of the second rib. Then after, second point will draw slightly lower than it, which is at the upper border of the third rib. Then after, third point will draw slightly lower than it, which is at the lower border of the fourth rib. Then after, draw your fifth point. Draw your fourth point at the sixth costal cartilage, and draw your fifth point is the fifth intercostal space. Okay, so by joining all this will be your heart. Why this is not perfectly drawn? Because this line goes to the downward, goes to the slightly upward. Okay, yes, and there is one point missing also. Okay, yes, but you can remember it, right? I told you like this 5 1, 2, 3, 4, and 5. Or you can either remember only reads like second read, here third read, here fourth read, here sixth read, and here fifth intercostal space 5 4 5. Okay, clear? Now this will be your heart, this will be your pleura, the lungs. Okay, so it is clear. Now there is something more about the transverse fissure of the lung and the oblique fissure of the lung, but it comes in the visit, not needs for you. Okay, now let's come to the face. Okay friends, we will do the face and the abdomen in the next time. Okay, and upper leg is not important. Yes, it will never ask. Okay, yes. So face and abdomen we will do it next time. Okay. Till then, bye bye. Thank you guys.